upon you and gave you a PM YWTV today. I'm so happy to have this time with you that we've put aside each day to hopefully inspire and engage you while we're all sheltering in place. And we've been bringing you conversations that are hopefully, helping you through this time, and also conversations that we were planning to have even when we weren't sheltering in place. And this happens to be one of those that was planned some time ago. As we've talked about, April is the Stand Against Racism for YWCAs nationally and locally here in northern New Jersey. And we focus our attention on issues as well. And also the YWCA this year being an important year with an important election. Every election's important, but this one is definitely one to focus on. We have rolled out a Why Women Vote series. And this was launched after our YWCA USA put out a national report that highlights women's top concerns. And it looked across demographics to see what women were concerned about during this election cycle. And one of the issues really had to do, a top priority in this report was sufficient family income, and how were women going to be able to support their families. So our intent all along, pre-pandemic, was to focus on this conversation and to invite Debra Lancaster, who's joining us, to be part of this conversation. We all know that frontline workers who are out there are in retail associates, nursing assistants. These are women that are providing the essential services. Whether or not we're in a pandemic, these are the women that are the backbone of keeping us all going in our society. And the majority of these roles are filled by women, and more specifically, women of color. And so it's essential that, especially right now, when these women are really putting their families and themselves at risk, for all of us to be able to safely shelter in place, that we are thinking about the conditions that they have to live with. Most of these women are getting these jobs are minimum wage jobs, and again, they are providing an essential backbone of the work to our society here. So again, this conversation was intended, but now with the lens of the pandemic, really has a whole, I think, new spotlight to it for sure. So we're so happy to have Debra Lancaster here with us today. We are beaming from different parts of the state, but both very eager to share this discussion with you. Debra is the executive director for the Center of Women and Work at Rutgers University. And there, she and that department focuses on research, education, and programming that promotes economic and social equity for women, their families, and our communities. I fully encourage you to get connected to their social media pages and follow. They put out some amazing papers and some wonderful conferences and discussions that you definitely should be connected to going forward. Prior to joining Rutgers, Debra served with the New Jersey Department of Children and Families. She was a chief program officer there, and she led the efforts there to modernize programming and systems to support women, children, and families that were challenged by trauma, poverty, intimate partner violence, and mental health and substance abuse disorders, which obviously was also a link for our work then as well, because of the Healing Space program that we support at YWCA of Northern New Jersey. So, Debra, thank you for joining us today.
Thank you for having me. You guys do amazing work, and I've been following your series, and it's terrific, right?
Well, we're so happy to have you be part of the conversation today. As we both know that women and women of color have really been impacted by COVID in very different ways during this time. We know that 1 in 3 jobs are held by women that have been designated essential. And there was a wonderful New York Times article that just came out that we actually will link to this broadcast in the notes so people can read it. that had some wonderful statistics and information in there, and hopefully brought light to everyone of this issue. It shared that non-white women are more likely to be doing essential jobs more than anybody else right now, and that the work they do is really underpaid and undervalued, is what we are seeing. That the labor force in this country continues to be running and take care of us most in need, whether or not we're in a pandemic. These women are, again, our essential backbone. Can you talk to us? We'll start right in with where we are. What's the landscape look like for low wage female workers right now? And these are women that for the most part we know are probably invisible to most of us out there. They're the nurses' aides, the store clerks, the cleaning ladies. I mean, what's it like for them right now?
So right now it's pretty difficult to look away from the inequalities and exploitation that have actually that's been with us for some time. So, and I think, the pandemic is, and we've heard this phrase again and again, and we used it in our newsletter early on, and now I'm tired of saying it almost, but the pandemic is really shining a light on a lot of structural inequalities, but also weaknesses in our social safety nets and the vulnerabilities within our institutions. So it's really kind of shining a light on what's already been weak and unequal and unjust. And so the landscape for women in particular right now is I think, a bit frightening. But I also think there's, I don't want to say there's a silver lining. That's easy for me to say, but I'm hopeful that this will lead to some change. Thinking about the home health, you highlighted home health aides, retail, and what was the other one? Cleaning, domestic workers, right? Yeah. So those are some of the occupations we had talked about. Thinking about home health aides in particular, and this is the workforce that enable the elderly and disabled to live at home, and many of us to work in other jobs. And they're essential workers during the pandemic and before the pandemic, as you pointed out. And we will never close the gender wage gap unless we revalue the care work that they and others do. So we have a persistent gender wage gap. We recognize that every year in April and then some subsequent months later, because the wage gap is much greater for women of color, for Black women and Latino women and Indigenous women, that we don't have quite a presence of Indigenous women in New Jersey, but in other states, you see that. And so care work is really, we don't value care work in our society, and you see that in the wages and benefits that child care workers and home health aides get. And I just wanted to share with you, we released a fact sheet recently on healthcare, home health aides in particular in New Jersey. And our state employs some of the largest numbers of home health aides. We're also a wealthy state, we're a populous state. We're a state with folks who are aging, and over 95% of our home health aides are women, over half are immigrants, and almost 70% are Black and Latina. And the annual mean wage in New Jersey ranges from just over $23,000 a year to $25,000 a year. It's outrageous, quite frankly. So these are the wages, and they are the workers who, are taking care of our most vulnerable, without a lot of personal protective equipment right now either. I should say.
Yeah, I think that's what I was actually just thinking as well. I mean, when we're and I actually can speak to this personally. I'm caring for my mother here at home, and we actually had early on aid workers coming in, and discussion with them about the fact that they didn't have enough personal protective gear, to be able to come in safely into a lot of the houses, and what a concern it was for them and their families. So I firsthand had some of these conversations. It is, with all of the attention, I mean, obviously, again, the New York Times article, I think, did a great job on shedding light, and hopefully it got into many households, to have people thinking about it. And I think the more that we've seen the newscasts and the media attention about essential workers, and of course, healthcare workers, have been, in the front lines, of getting the accolades for sure. But, I do think that the grocery store workers, the store workers, and, have really started to, people have really started to realize that,
Mhm.
we cannot be comfortably sheltering in place without them and the work that they're doing. So I think that they've started to kind of get their, hero capes, slowly coming, to them as well.
Yeah.
But what do we think long term, though? I mean, after this pandemic comes and, goes, which of course I know we're all hoping it goes, sooner than later, from that perspective, where do we think this is going to leave, women in these positions that are, really historically have been undervalued?
Um, I think it might be a little bit different for different sectors. So I think not to focus completely on home health aides, but that's an industry. I'm thinking about where these different workers are paid from, and the source of. Although I know many individual families, and I'm sure you do as well, who pay out of their own pockets for support. Most of the home health aides, most of their wages actually comes from us as taxpayers through Medicare and Medicaid. And so I think that, right, and this is why, it matters, elections matter, right? Thinking about who has what policy, Medicaid policies matter, Medicare policies matter. But the payment structure and the structure of home health care, I'm hoping this is an opportunity where this will elevate some of those discussions, as well as long-term care facilities, which we're seeing, so many of our, so much of the death that we're seeing, actually, the source of that is from long-term care facilities. And I know it's complicated, and I'm not an expert on it. We don't have to talk about that now, but I think there'll be a lot of opportunity, and part of the expression, to do like a post-mortem on what's happened in long-term care facilities. And I think this can, again, hopefully open up some discussions for real change in the long-term care industry, so that we can elevate both the value of the work that these workers provide, but also, assign appropriate wages and benefits, or come up with some kind of public assistance or other type of support, because it just can't continue. It doesn't, the quality of care is at stake. Anyone who has an elderly person in their family or a loved one, they want to be able to have care they can rely on, and they need a stable workforce to show up for them. And so that's one area. I think that what we're seeing, and again, I don't have scientific evidence for this, but believe me, my colleagues are on it, right? They are looking at they're looking within the social movements that existed before the pandemic, and kind of some of the worker actions that are happening now. And we see that in our local news here in New Jersey, as well as in places like the New York Times and Washington Post, where workers are demanding better working conditions, and particularly related to COVID-19, but I think beyond that. So I'm hopeful that there will be some working conditions that improve out of this. And some employers have been offering what they're calling hazard pay, or, and I think in part because they want to make sure workers show up, right? But also as a nod toward recognizing the harm that they're putting themselves, and the inconvenience of the pandemic. And that's not the best word. The pandemic's more than inconvenient, but
right.
So
yeah, and I guess we would hope that when this is all behind us, that hazard pay somehow becomes part of their regular pay. That this, So we think about, again, all these, different areas that these essential workers are, but these, low paid and undervalued essential workers are. Um,
Yeah.
so wages is one of the places we want to see an improvement, for them, for sure. What are some of the other places we want to focus our kind of advocacy and thoughts and discussions about?
Aside from wages. Oh,
Yeah,
and, I think that, and we know, and I just want to point out, right, because it's Denim Day,
yeah,
right?
yeah,
But, we know that women's economic stability in particular insulates them from what I would say, other pandemics
hmm
um, and public health issues that have also existed for a long time, including domestic violence. And so it's really important that our women and families have access to living wage jobs. Everyone should have a living wage.
yes.
In New Jersey, that is, definitely above $11 an hour.
Right.
So, but you asked me another question. I already forgot what it was.
Yeah, I don't know. I was asking, so, we know that wage is an issue. What else should we, be, again, because our purpose for this is really to educate folks watching on the issues that we should be thinking about to better support and advocate on behalf of, the women we're talking about. What else should we be thinking about for them?
Well, I think healthcare is a huge issue that comes up again and again, and we saw that during the during the primary season, particularly among the candidates,
Yeah.
and Medicare for all came up. I'm not, I know that. And I think what we're seeing right now is the weakness that we have in our system of relying on employer-sponsored health insurance,
Mm-hmm.
which in the Affordable Care Act certainly helped us advance our coverage in this state and around the country. But there's a lot of concern about the affordability of that, particularly among low-wage workers. And when we've done focus groups with women and you hear from workers who work in the logistics industry or like in warehouses, in retail, in hospitality before it was kind of shut down and will hopefully come back, they really struggle with paying for health insurance. And, if they make wages that are so low, they can have access to Medicaid. But then they get a bump in hours or they get a raise, and then they have to pay for health insurance and are choosing between health insurance and food, and you're going to pay for food, right? You're going to choose food, or you're going to choose rent or your kids' school uniforms or bus tickets. So it's really quite a dilemma. And and again, I think, not to keep talking about COVID-19, it's hard not to. We're inching toward, I think last unemployment numbers, it was well over 800,000 people in New Jersey had filed for unemployment. I mean, astronomical. Those folks, many of them are going to be out without health insurance.
Yeah.
And so there's a real, I don't have an answer for it, but it's something that we really need to pay attention to. And I unfortunately, I think more people are paying attention to it because they're being directly impacted.
Yeah. I do think that that's true. I think that, when we are, whether we're going to the store ourselves and, seeing that the shelves are being stocked, by somebody, or whether someone is delivering our groceries and leaving them on our front steps, and realizing that that person doing that is, out there putting themselves in jeopardy because they need their paycheck.
Right. I don't know if you've seen the headlines, and these are another thing. This is shining the light on, or I've seen folks worry about the supply chain, right? Like, and I still think many of us, I will just say I'm incredibly fortunate, right? Like I know I probably have enough food in my cabinet really to probably feed up for a month. But I will say that, I've been following the news on the meat packing industry, or the meat plants, right? And the poultry and meat plants. And we see that there's been significant outbreaks of COVID-19. Workers are getting sick and dying. And you see the working conditions that they're working within. Again, these are also low-wage jobs. This is not an industry that we have here in New Jersey. It's different, but out in the Midwest. But we certainly rely on these processing plants to bring food to our stores. And, again, it's largely people of color, a lot of women, a lot of immigrant labor working for a minimum wage so that we have access to relatively cheap food. So, this pandemic's, raising all kinds of, again, these things have always been there, but I think there may be additional momentum to make change and to think about, what kind of society do we want to live in going forward?
Yeah, I think that's, right on point. Again, none of these things just popped up now. They've always been in existence. And for those of us that do the type of work that you and I do, we've been talking about these things for, many, many years. But this definitely has accelerated the conversations and put a spotlight on them in a way that, and I understand what you were trying to say earlier. We have to look at this in some ways as an opportunity right now to be able to hopefully push the agenda to address some of these issues, because it's mind-blowing that as a country that we are responding to what's going on like this, as evolved as we are, right? But partially that's happening because, we really were not as evolved as we thought we were.
Right. And, yeah. So I think, really pay attention to what workers are saying, and the protests that are going on. Workers are speaking out. Their advocacy organizations, stakeholders we've worked with for years, really have their hands full right now. One is, I work with some organizations that they're organizers, and they're used to organizing workers and organizing in communities, and now they're also providing direct concrete supports to their members. So it's really hard because they've been impacted by the pandemic. So some of them are experiencing significant unemployment. We have many undocumented workers in New Jersey and around the country that we rely on. And there's an example of a group of workers who don't have access to some of the relief that other workers have. And they very well, maybe they're paying taxes. They've lived here for years, and unfortunately are not part of the CARES Act, or and they aren't able to file for unemployment. So that's another group of workers that kind of shows up. Some of our colleagues just put out a report about this with New Jersey Policy Perspective, I think yesterday.
Oh, yes.
I'm kind of estimating the number of workers and their contributions to our economy, but they're also being left out of the recovery. So, we've kind of built our economy relying on, hoping this all works. It's kind of jerry-rigged a little bit to some extent, and it's kind of fallen apart in that way.
So, our national organization, as you know, put out this report earlier this year to bring attention to the issues that women are concerned with as we move forward into this election cycle. And we know that women having sufficient income and meeting family expenses was top on that list. And again, that was pre-pandemic, that was on their minds. And so, what do we think? Let's fast forward to when we go back to a, quote unquote, normal time, which I'm not sure what it'll look like, when we do go back, because it seems like it won't feel normal. Even if we do go back, it's not going to feel normal for some time based on everything, you and I can probably piece together from what we're hearing. Mm-hmm. But what do we think we can expect for working women going forward? What's the landscape going to look like for them?
So what do you think? I was wondering. I'll answer the question. It's a tough question, right?
It is. It is a tough question. It is a tough question. And I think it's also a tough question because a lot of the women that went into this working are going to come out of it not being employed, for sure.
Right.
So even the women that took that survey and had that high on their list, may find themselves now with even greater concerns.
Right. Yeah. And there's so many issues to explore. I think some of it depends on what the new normal looks like.
Mm-hmm.
I'm cautiously optimistic, right? Because otherwise I'll just like crawl under my covers and not come out. I mean, I think we have gone through, this is a turning point in history, and we have gone through challenging times before, whether it's the Spanish flu. I was reading something, I don't remember where it was, but about the suffrage movement and
we actually just posted that article. We just posted.
Oh, maybe that's where I saw it.
Yeah, the page. Yeah.
I think that so I think that we will recover in some way, and I think what's important is that we all stay active in this recovery. And to the extent possible, yes. I mean, I also hope that we continue advancing research, right? So I think, we're at Rutgers. We want to be doing research that we were doing before the pandemic, but also we want to kind of study the impact of it. Even more importantly, though, I think start thinking about the policies and practices that are going to help reduce inequality going forward. So it's great that we know that there are all these problems. And we need to pay attention to who we vote for, both locally and at the national level, and then help our legislators and our policymakers prioritize what's important. Because we're not going to, probably we never can do everything at once. When I was a bureaucrat, I like to think of myself as an enlightened bureaucrat.
Mm-hmm.
No matter who the boss was, right? Who the governor was, you have to look for, where are the opportunities to move the ball down the court, right? So what are the things we can fix now with the resources that we have that'll be there even after you leave, and, hopefully accomplishing those goals. So I think, hopefully we can, I mean, if I were in charge, I think, how do we, I think healthcare is a big issue where, we need to revisit how we strengthen that. I'm really interested in let me find the name here because I have been less, how we're going to deal with caregiving going forward. So there's some really, and I think you had some of those who have been advocating for universal family care. Recently, I think the Y hosted some of the advocates for that. They wear many hats, but that's one of the areas, like caring across generations. So, a fantastic group. And those policies that kind of recognize that, and it's not just women, but give families the opportunity to care for their loved ones. Would really be helpful, and is something that the door may be open to as well, because we see, every state is, struggling. Families are struggling with how to take care of sick loved ones, juggle work and family. Mm-hmm. Those are also issues that are all coming to light. We have families, some essential workers, they have 3 kids at home, homeschooling. It's so much to manage now. So I think those issues about the gaps in our care infrastructure, caring for the old and young, and for ourselves in time of need, we need to be able to allow consumers to purchase care and be able to afford that, and also be able to step back from their paid work to take care of others and do what's appropriate for their families.
Yeah, I do think it's put a tremendous lens on so many. I mean, obviously, whether it's with teaching, right? I mean, teachers is one of those. We never are paying our teachers, properly in this country, and now every parent is suddenly really understanding the teacher's job is up close and personal in terms of in-home schooling for sure. So, you would hope that that's something, I think that gets some traction, going forward. I do think the plight of the working parent and, the working mother, is definitely that juggling act.
Yeah.
And it definitely has, and I know we have children of different ages, and that comes with different challenges when you're homeschooling, the different age groups for sure. But, trying to homeschool and trying to work and trying to care for my mom and have everything happening in, our house, and also trying to manage meals and shopping and all of these other things, it definitely sheds lights on the role. Uh,
Yeah.
Definitely, whether it's the working parent or the domestic caregiver or whoever, whatever the role is, I think that there's definitely attention to looking at things differently,
Yeah.
from this experience. So I think it definitely has put all of the conversations that we in our both of our roles and others have been having for a long time. As I said, it definitely, I would hope, highlights them to the average person. I'm hoping, and I guess that's where when we have these discussions, we always try to leave our attendees and those watching with kind of some action items, action lists. Where can they get involved? What can they do? What is something that they can take from here? Obviously, we've highlighted some of the challenges and some of the issues. Obviously, vote, right? Register to vote,
Right.
vote. Census, we keep bringing people back to,
Census. Yeah.
for sure. But what are some pieces of legislation that we should really have our viewers focused on and learning about, and picking up the phone and letting their representatives know how they feel about?
So I think, and I don't know where it's at, but the name of the legislation I was thinking about before is universal family care.
Yeah.
So I think, keeping a pulse on that is going to be really important. Anything that, and related bills around paid time off for family care.
Family Medical Leave Act, right? I guess that's
Yeah.
another. Yeah.
Uh-huh. In New Jersey, the good news is advocacy really matters. So New Jersey has passed before the pandemic earned sick time.
Mhm.
So we have earned sick time in New Jersey, which also, and this is, I think, relatively unique for the states and municipalities that have passed earned sick time around the country, also allows victims of domestic violence to take time off when they need to care for themselves or you need to care for a loved one. So the earned sick time in New Jersey is really beyond like your household. It could be your best friend that's like a sister. It could be your neighbor in need. And we also expanded in New Jersey family leave insurance that allows parents to take time off to care for a newborn, for example, or an adopted child. And that's important. I mean, I think that it needs to, we want it to go, again, I'm practical, so that's what we could do in New Jersey. But there are certainly opportunities, I think, to push that on a national level, depending, again, what the landscape looks like in the future. Because the more we can do that, we don't want to have to rely on every single state to have the answers. But I think New Jersey's an interesting incubator of policies that support working families and has been a lead for some time in that arena. Mm-hmm. And so I think learn what's gone well, what hasn't gone well. And I think that can inform national policy. But my long-winded point is picking up the phone to your legislator really matters and helps pass these bills. And, I know there are advocates right now who are trying to get some support for the undocumented workers that we rely on. So that's another opportunity. If you support that, you can look into that. Read up on it, and then you can call your legislator and tell them what you think. And they do pay attention to those calls. Believe me, I worked in Trenton for 12 years. We would get calls. If someone had a complaint, which is good. I mean, we have to keep we got to keep our government accountable.
Right. I mean, at the end of the day, they work for us, as I always say.
That's
So, they need
absolutely.
to know how we feel on issues. And I think, we've seen that, whether it's the postcard campaigns or sending an email or picking up the phone, they do listen, and they need to hear us. So I'm glad
The
that you.
minimum wage, I would say, don't think that's something active right now, but a $15 minimum wage for across the United States is also something that's come up, or living
Mhm.
wages are incredibly important to set that floor at a reasonable level.
Yeah.
Um, and we still don't have it actually for tipped workers in New Jersey. Their minimum wage hasn't gone up in like 30 years, right? So we'll have to think about them. The important thing is we can't forget about these essential workers assuming I think things will go back to some kind of normal at some point. We
Right.
can't
Right.
forget about them. And we also need to think about I think, we'll definitely have to have some kind of teacher appreciation day, after this is, I want to say after it's over, but the transition back to school is also going to be challenging, right? And so I think supporting our teachers and doing what we can to support our schools right now is going to be really important, because they're going to have a lot on their hands. They have a lot now. They really pivoted, and they are also experiencing changes to their careers, right? Most second grade teachers didn't sign up to run a classroom online.
Yeah.
So we, need to be patient and supportive of our teachers.
Well, we've definitely given everyone a lot to think about from this discussion, and I'm grateful that you shared your thoughts and from your experience. As we close out, can you tell us a little bit about the work you're doing at Rutgers, so that we can, I love for people watching to get connected with you guys and what you're doing, because you really are, you know, pre-pandemic. Again, this is your work. I mean, you kind of have the pulse and the research, and so please share.
Sure. Well, you can definitely check out our website, which never looks as great as we want it to, but we've been trying to keep it current. So you'll see our newsletter there, as well as our kind of latest fact sheet on New Jersey home health aides.
Mhm.
I think we're having a brown bag lunch tomorrow with two Center for Women in Work affiliates from the School of Social Work, covering the topic of wage theft. And so some of what we're doing is trying to create a space for Rutgers scholars to bring their emerging research that intersects with women, work, and other topics to us, so that we can support them in those efforts. And kind of what we like to do is we want to make sure that research is meaningful to stakeholders. We're a public university. I feel really committed. We shouldn't do just research for research, but we're interested in what stakeholders, like, what do you have questions about, and how can we, help you get those answers, right? If there's a policy we think is, we want to pursue, but we need to do some analysis on it, we want to work with stakeholders in that way, so that the research that we do has some connection to the concerns that the community has. We also like to disseminate research that people are doing to stakeholders, right? So we have a lot of academics are really good about staying in their lane and thinking long and deep about a particular topic. And we like to help them, get out of their offices and disseminate some of that important work to real people and practitioners. And so we're kind of an intermediary in that way as well. What you can expect from us, in the short term, we finished up a project on fair scheduling that we did with some partners that focused on the scheduling practices of, like, the warehouse industry or logistics industry and retail and hospitality. And so that's interesting. Not sure where that will go going forward, because some of those industries have been seriously disrupted. We have been working with some stakeholders on the working conditions of domestic workers in our state. And so that'll be coming out probably the end of May. And then we also, Yana Rogers, who's our faculty director and a feminist economist, has been really what she brings a lot to the table, and one of the things she's brought to the table is a lot of global work. So a lot of her work is in global development, and so we've been doing some training with the United Nations UNIDO, and training some. And what else have we been doing in that space? So we have a global element that we're trying to build out. So we do a lot of New Jersey work, and we have this global work that we're building out. And then, so that's kind of.
It's a good holistic picture for women.
And we do some training as well, and women's leadership development. So.
Well, we appreciate all that you're doing in your, corner of the world, and it's how it's impacting the entire state and the country for sure. And I know we'll be talking again at other YW events and otherwise, and I appreciate your sharing your thoughts on these issues for us. Debra did mention earlier Denim Day, so I just want to make sure I'm wearing my denim. She's wearing her denim too. She's braver than I am because she's wearing jeans. I have, as I shared, and I don't mind sharing publicly, I've not been in jeans for many weeks now. So the jeans shirt was much more comfortable and more of I knew I was getting it on, no problem.
My family wondered what was happening. They're like, What's going on, Mom?
Jeans. But Denim Day, for those of you that don't know, our Healing Space, our Sexual Violence Resource Center, annually does have a Denim Day during April, which is also happens to be Sexual Assault Awareness Month. And you can research Denim Day yourself. It actually started out of an incident that happened in Italy many, many years ago of a young woman who was sexually assaulted. And when the case went to trial, the judge blamed her because she happened to be wearing tight jeans and felt that gave the offender the right to sexually assault her. And as supporters of survivors, which I know Debra and I both are, that we believe survivors and we support them, we think it's important to make statements like wearing denim on a day like today to make sure that everyone understands it doesn't matter what you wear. It doesn't matter, that these are not the issues that, survivors need to be, that, all individuals need to be safe from sexual violence and interpersonal violence, and that it's important that we support survivors. And survivors during this time, our sexual violence hotline, 201-487-2227, our entire team at Healing Space, shout out to them. They pivoted, we shut the office on March 16th, and by March 17th in the morning, everyone had gone remote. All of our counseling had gone to a HIPAA-compliant counseling virtual program. Our advocates had set up opportunities to be able to support survivors that still were showing up to the police departments and hospitals for care, and our hotline remained intact. And even our prevention and education team pivoted very quickly themselves to be able to provide virtual support to the schools and the communities. In Bergen County for sure, and across the state, because with all of our sister agencies, we are here to support survivors. So please reach out. You don't have to feel that because you're sheltering in place right now that this is not a time that you can get support. We're here for you. So with that, and as we close out our time together today, I hope you join us tomorrow. In the morning, we'll be talking with Amy Edelstein, who's part of our, she's one of the clinical supervisors that has been with our team for some time. And we're going to be talking about some of the child anxiety issues that have popped up as a result of sheltering in place and COVID. And we will talk through about what they are and some ways to help parents navigate them. April also happens to be Child Abuse Awareness Month. As Debra mentioned, and, we spend a lot of time, those of us doing survivor work, this has been a very challenging time sheltering in place for domestic violence survivors, for anyone who's experiencing child abuse, unfortunately, and sexual violence survivors. People can be stuck in their homes with their abusers and have very limited ability to be able to get away and get word out and get help. And we are going to have a conversation with some of the experts in New Jersey to talk a little bit about, what resources are out there And that way, those of you watching, if you become aware of a situation, you'll know how to help direct people towards safety. Again, thank you so much for this time together. We appreciate you. We hope that you're all staying healthy and well. We know that this time is challenging, and everyone's kind of having a different experience with it. Wherever you are, though, we hope that you're healthy, and we hope that, if you do need support, that you're able to find it around you, and if not, that you reach out to one of our organizations so that we can help with that. So be well, and see you all tomorrow. And Deborah, thank you so much for your time today. And
It was so good to see you.
good to see you too, and look forward to doing it again soon, both virtually and in person. Take care, everyone. Be well.
Bye.